Hello all, myself Mushida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today I'm going to talk about a neurological condition called spina bifida, which is most common in pediatrics. Let's get into the topic. Spina bifida, often referred to as split spine, is a congenital condition where the neural tube, which eventually forms the brain and spinal cord, fails to close completely during the early pregnancy. So it is a birth defect where two sides of the fetus spine should be joined during development. And in case if that doesn't join together and leaving a gap in the affected area, that condition is called as spina bifida. This can lead to varying degree of physical and cognitive challenges after birth to the child. The types and classifications of the spina bifida. Spina bifida is basically classified into three types: spina bifida occulta, spina meningiosi, and myelomeningiosi. Spina bifida occulta. It's often the mildest form, where a small gap in the vertebrae exists, but the spinal cord or nerves are usually unaffected. Only the vertebra is split into two without a closure. It might present with a tuft of hair or a dimple on the lower back, which is the affected area. The next type is the meningiosis. It involves the meninges. Meninges are the membranes protecting the spinal cord, protruding through the spinal opening, forming a fluid-filled sac in the affected area. So nerve damage is usually minimal, leading to few disabilities in comparison with the myelomeningiosis. The third type is the myelomeningiosis. It's the most common form, where both the spinal cord and meninges protrudes and forms a sac-like structure outside the lower back. So this often results in significant nerve damage, leading to paralysis, bowel and bladder dysfunction, and it may associated with the hydrocephalus also. So you can see the occulta, in which the vertebra is missing, so that the tuft of hair present here and a dimple can be seen in the occulta case. In case of meningiosis, only the meninges will be protruding outside. The nerve structure and the spine is not affected. The myelomeningiosis, along with the nerves and the spinal cord, and also the meninges, is protruding outside and form a sac-like structure. What causes the spina bifida and who are at risk factors to develop a spina bifida? Genetic predisposition, family history of any neural tube defects increases the risk. Certain genetic variability may increase the influence of susceptibility of spina bifida to the child. Nutritional deficiency during pregnancy, folic acid deficiency is the primary cause, and inadequate intake of food before and after the early pregnancy is critical. And environmental influences, exposure to certain medications like some anti-seizure drugs to the mother causes the spina bifida. Maternal obesity can be a cause. Uncontrolled diabetes during pregnancy can be a cause for the spina bifida. Early diagnosis from prenatal screening to postnatal confirmation. So MSAFP, that is maternal serum alpha fetoprotein, is usually screened between 16 and 18 weeks of pregnancy to measure the alpha fetoprotein level, which indicates the higher risk for neurodevelopmental defects. And fetal ultrasound, in case if the maternal serum alpha fetoprotein results are abnormal, we need to inspect the fetus through a detailed ultrasound, which can often visualize the spinal defects, hydrocephalus, and other associated anomalies in the fetus. And amniocentesis, this is a procedure to collect the amniotic fluid to analyze the alpha fetoprotein and also the acetylcholinesterase level that provides the more definite diagnosis of the neural tube defects. The next is the postnatal examination. After birth, physical examination, MRI, CT scan can confirm the diagnosis and determine the extent of the defect. This will guide us the immediate treatment plan. So early and accurate diagnosis is pivotal for planning appropriate medical intervention and support for the family. Early diagnosis with the help of fetal inspecting the spine. In this you can see the ultrasound with the screening of the spine will shows the defect in the spine. So here there is a abnormal closure of the spine. So the child is present with the spina bifida. So we can early diagnose it. And after the birth, you can inspect the spine with the help of MRI and CT so that you can visualize the myelomeningeal in this case. So you can clearly see the defect and which extent the myelomeningeal got affected. That can be clearly inspected after birth with the help of MRI and CT also. Comprehensive management. Surgical closure can be performed within 22 to 74 hours of birth for myelomeningeal to prevent the infection of the protruded sac, which contains the meninges and the spinal cord. And we can further prevent the nerve damage. Fetal surgery is performed before birth, and it's also some option for some cases. Hydrocephalus management, in case if it is associated with the hydrocephalus, placement of shunt to drain the excess cerebrospinal fluid from the brain to other part of the body. Regular monitoring of the shunt malfunction is needed. Bowel and bladder management, regular catheterization and medication for the bladder control. Dietary modification and bowel training program should be advised to the child with the help of the family support. Orthopedic care, physical therapy, occupational therapy, assistive devices such as braces, crutches, wheelchairs to provide the mobility and function once the child reaches the age after 5. These can be helpful. And surgeries for orthopedic issues like clubfoot or scoliosis can also be preferred. So comprehensive management of spina bifida is a lifelong journey. It requires a multidisciplinary team approach from initial surgical intervention to ongoing therapeutic and supportive care. So our goal is to enhance the individual's quality of life and provide independence. This picture shows you the exposed neural tube. So it is surgically closed so that the neural tube is protected. So this is also a real surgical picture in which the neural tube is exposed so that it is closed clearly. So to prevent the infection and also to prevent the deformity. Living with the spina bifida, there is a lot of challenges and the patient has to under a support and we need to empower the spina bifida cases. Physical and medical challenges are there and educational and social integrations addressing potential learning differences are vital for holistic development. Emotional and psychosocial or a psychological well-being has to be given with the proper support by promoting self-esteem, coping strategies, and mental health has to be given through a proper support system. Advocacy and rights, empowering individuals with the spina bifida and their families to advocate for their rights, accessibility, and inclusion in all aspects of society should be emphasized. So living with the spina bifida presents unique challenges, but with adequate support, resources, and strong community, individual can lead to fulfilling and empowered life. So focus is shifting from mere survival to thriving and full participation in spina bifida nowadays. So prevention is the key. The critical role of folic acid plays here. Significant defects can be prevented with the help of the folic acid. Adequate folic acid intake, which is a great preventive measure against the neural tube defects. So vitamin B also plays a crucial role in healthy development of the neural tubes. So supplementation, childbearing age, women should take 400 microgram of folic acid daily, ideally starting at least 1 month before the conception and continuing through the first trimester of the pregnancy. Fortified foods, many grains, cereals, bread products are fortified with folic acids, offering another source of vital nutrients. This should be educated to the mothers. And the natural sources, leafy green vegetables, citrus fruits, beans, nuts are the natural source of folate. These natural forms of folic acid should be consumed by a pregnant woman to prevent the neural tube defects. So public health campaigns, widespread awareness about folic acids are essential. By promoting an early and consistent intake of the folic acid, we can significantly reduce the incidence of spina bifida and give more children a healthier start in life. So advancing researchers are continuing towards the innovative surgical techniques to improve the outcome and potentially find a cure for the spina bifida. And we have to strengthen the advocacy by patient organization and supporting the healthcare access, inclusive policies, increased public awareness should be conducted with the help of the society. And promoting education about the management of the spina bifida and the general public role and educating the communities to reduce the stigma and foster the supporting environment is needed. So journey for individual with the spina bifida and their families, one of the resilience and hope. Through our dedicated research and tireless advocacy and ongoing education, we can pave the way for future where the spina bifida is not only better understood and managed, but potentially even preventable for more families worldwide. Thank you.